our executive committee meeting to order. And why don't we go around the table and introduce ourselves?
I'm Steve Manella. I'm the Human Services Manager at Lane County.
Pat Farr, Board of County Commissioners.
Chris McAllister, representing former homeless persons.
Lacey, Homeless Youth Representative.
Stephanie Jennings, City of Eugene staff.
Amanda Borda, Lane County staff.
Alex Dreer, Lane County staff.
Erin Fifield, City of Springfield staff.
Lucy Vennis, Mayor of Eugene.
Dan Bryant, Vice Chair, and First Christian Church.
I'm Pat Walsh. I have Vox Public Relations. Well, welcome, everyone. Has everyone had a chance to look at the agenda? And does that look acceptable? I know, Chris, you'd like to add something here toward the end of the
Yes, sir.
meeting? Okay. We don't need to do anything with that. So we're going to do that. We'll have Chris will be number 6, and then we'll go to public comment at 7, and then we'll wrap it up. How about we're up now on the consent agenda. Is there any questions, or does everybody have a chance to take a look at it? If not, we probably need to approve the consent agenda, don't we? Do we have a motion?
I'll move. We approve the consent agenda.
Mayor moves, Chris seconds. All in favor, signify by saying aye.
Aye.
Aye. Any opposed? All right. Well, let's move on to Alex and the point in time count and housing inventory.
All right.
Wait a second,
Chair,
Pat.
just for the folks in the audience, in case you're wondering, the gold stars are voting members of the Poverty and Homelessness Board. The other are ex officio members.
Or staff.
Or staff.
Staff. All right, Alex, point in time.
Thanks. I'm Alex Dreer, Lane County staff. The point in time count is the annual homeless count. We conducted it for the night of January 30th, 2019. The final numbers have not been released. The full report will be released at the end of this month. I wanted to give a general overview of what we're seeing in the pit count, but again, the final report is not yet ready. So of the total, the point in time count, just to give you a recap, covers, and it's a snapshot in time. We know that it is not an exhaustive list of the number or the conditions of people experiencing homelessness in Lane County. It tracks 3 different items. One of them is the unsheltered homeless population, the sheltered homeless population, which includes people living or staying in emergency shelter or transitional housing, and the housing inventory count, which looks at continuum of care beds and units that are dedicated to people experiencing homelessness. So when you hear about rapid rehousing, permanent supportive housing, and emergency shelter beds in the continuum of care, which is all of Lane County, that is reported in the housing inventory count, or the HIC. So this last point in time count, what we have seen is 32% increase in unsheltered homelessness. That's an increase in about almost 500 individuals who are unsheltered. It makes sense with what we're seeing in Service Point, our homeless management information system, that level of unsheltered homelessness. And we know that Lane County and City of Eugene worked together to address the high number of unsheltered people in our community this past winter through Camp 99, and then expanding Dusk to Dawn, and trying some innovative projects to make sure that people had a safe sleeping space that was warm last winter. Of course, the majority of the increase in people experiencing homelessness was in the unsheltered population, and that is because we have not added significant shelter resources, so it makes sense. As people become homeless, they have to be unsheltered.
Alex,
yes.
do you want to mention too the status of things like Dusk to Dawn and the unsheltered count?
Oh yes, so as a reminder, alternatives to shelter projects such as Dusk to Dawn, which are MASH style army type tents that are heated with mats or different bed situations, Opportunity Village, car camping, those types of alternative programs are counted, rest stops, they're counted in the unsheltered population because For the point-in-time count, we use HUD's definition, the Department of Housing and Urban Development definition of homelessness, which means literally homeless, living in a place not meant for human habitation. So while we know that in our community, we kept people, had safe sleeping accommodations, warm, sanctioned places where they could be without harassment, that does not necessarily show up in the point-in-time count. So we had 411 people who are unsheltered in alternative to shelter programs this past winter, including Opportunity Village, Dusk to Dawn, Dawn to Dawn micro tents, car camping programs, and rest stops, community-supported shelters.
It was actually more than that. I think what you're saying, it was 411 as of the point in time count.
Yes,
Yeah,
at that
because
point
there
in
were-
time.
At that point in time.
I think, yeah, I think it'd be important to show that the increase, the 500 increase is not because of an increase in those programs. It's not that we've attracted a whole bunch of people that are in all of these wonderful new alternatives. I mean, the only big increase that we've had this year is in the Dusk to Dawn, which was,
We went from 115 to 240 beds.
so it almost doubled in size.
Yeah.
But that's only a fourth of the increase that we saw.
Mayor Venice, did you?
Oh, I was, a similar point.
Okay.
Yeah.
Great.
Of all the people experiencing homelessness who were counted in the point-in-time count, 1/3 reported that they live with a mental illness, and 1/4 of the people reported that they struggle with a substance use disorder that keeps them from remaining stably housed. We found a significant population who were experiencing chronic homelessness, and the volume of homelessness, the volume of chronically homeless veterans increased in proportion to the overall volume that we saw in the point-in-time count. As consistent with what the shelter feasibility study and homeless service system analysis found about the volume of homeless single adults in our system, the point-in-time count found 87% of those experiencing homelessness in Lane County were single adults. So the majority of the volume is people who are in households of one or single adults. Are there any questions that I can answer? In general, the final full report will be out at the end of this month. And that will be all, the information will be on our website, lanecounty.org/homelesscount, where you can find past reports as well.
Steve, do you have anything you want to add, or?
I would just say that I think the information will be useful for this group and others, and, you know, can be incorporated in things like the work of our strategic planning committee, looking at how we implement the TAC recommendations. I think the other thing that I've found to be helpful is to be able to drill down. You know, we've been looking at things in our office, looking at data, and when you look at the chronically homeless population, those that have been homeless more than a couple of years, you know, we're seeing more senior citizens, more people who are above the age of 55 as proportionately as a part of that group. So I think as we talk about devising our strategies for supportive housing and other kinds of things, we need to take in consideration the needs of the folks that, and the data helps us with that.
Another item I want to mention is that this year, for the first time, we conducted a youth-specific point-in-time count, and while that survey was a part of the overall point-in-time count survey, that youth information will be reported in a separate report. And for youth, we did count those who are couch surfing, doubling up to age 24. So that information will be compiled separately.
And that's the first year we've had that.
This is the first year we've done a youth-specific point-in-time count.
Okay. So it'll be the big, Pat?
Thank you, Mr. Chair. I have two questions that you can, if you have short answers. One is we've historically, we've questioned the accuracy of the count, that it typically understates the numbers. How do you feel about that this year? Do you have a short response to that?
We have a high level of confidence in our point-in-time count because we use a full census survey, and we combine data both that's in Homeless Management Information System Service Point to identify people who were experiencing homelessness on the night of the count, as well as a street survey. That's where volunteers go out and survey people on the streets. So that combination of information gives us a high fidelity, but we know we are not reaching every single person.
Thank you.
Yeah, the other thing I would say to take into consideration that maybe is a little bit more specific is that during the period of time that the one-night count was taken, the Egan Warming Center was open. And also, we capture a lot of people who are unsheltered, who don't use any other social services through feeding sites. So we have, in contrast to some other communities, we have a whole lot more participation in the point-in-time count.
Okay. And just a follow-up to that, I'm sorry, go ahead, Alex.
I'll need to follow up. I'm not sure if Egan was activated on the night of the count.
It wasn't active, but it's part of the data because
Yes.
the data is from that period of time. They allow you to go several days before and several days after the actual count to use the data from your HMIS system to make sure you're getting everybody.
Then a follow-up to that, just a question, are there any asterisks this year with a point-in-time count that make it seem more accurate than historically? Or can it be used on the same bar graph with historical points and counts? So the 33% increase is, there's no particular reason that we grabbed more people, that we're able to count more people that we didn't count last year or the year before.
The methodology is consistent with what we've been doing in the past few years.
Yes.
It also follows, we can see West Coast trends of rising homelessness. Those are due to a lot of external factors, high housing costs, stagnant wages.
Thank you. That is what I wanted to hear and what I expected to hear.
It's consistent with other trends in Oregon and the West Coast.
And I have one more question, Chris, unless you're following up on this same one.
I just wanted to speak to the methodology. Some of when we miss people, sometimes it's due to HUD definitions. Doubling up for adults doesn't count and things like that. And also, I feel like under our new methodology that we tried this year, that we have the ability to capture even more as we settled into it. The grid method that Alex proposed this year, I felt was very efficient, at least for us capturing some of the Springfield data.
Then my other question, Mr. Chair, if you'll indulge us, how does HUD use this data? I mean, they take the data from all the counts across the nation. Did they use it to allocate resources, for instance, or is it just a data bank that's been amassed?
So yeah, I can speak to that. HUD uses this as one of the data sources. So we submit a variety of reports to HUD throughout the year. One is the point-in-time count, as well as the housing inventory count, which gives you the people and the beds. That sort of gives you a vague kind of unmet need that they're looking at. But then we also submit our AHAR, which is our annual homeless assessment report. And that kind of looks at throughout the year what our data looks like. So that's the report that goes to Congress, and that's really what they see in terms of data and what they look at nationally in terms of numbers. We also report our point-in-time count through our continuum of care application. And so, our score is based on how we're making movement in terms of our point in time. That contributes to our system performance measures. So if it's increasing, they do look at that and consider that in terms of our score and our funding.
Perfect. Thank you, Mr. Chair.
So a couple of comments, and specifically following up on that, if you look at the AHAR from last year, I mean, the alarming thing was we were mentioned in 11 of, I think there were 14 graphs, and Lane County was in 11 of those graphs as either first or second in those particular categories.
For a continuum of our size for a population.
Yes, in our size. Thank you for
Yeah,
that
because there were
clarification.
larger communities and they also had rural over here.
We were in the category of suburban.
Right.
Yeah, not major cities, so they
Right,
didn't compare
right.
us to the major cities, they compared us to regions of our size, so.
Yeah.
Jersey, for instance, would be in the
Yeah, and it was just shocking to me. I mean, I encourage people to go back and read that and look at that, because it is rather shocking to see us appear so many times in that report. I mean, this is covering the entire nation, and that we get mentioned once or twice, yeah, but 11 times. And the other thing that just worries me with this point in time count, I mean, it kind of confirms what many of us have just believed on the street, that there is a significant increase, that we are in a crisis. And while I support everything we are doing with TAC as absolutely the right direction, my concern is so much of TAC is long range, 2-3 years and beyond. And we've got to do more immediately. And I just see a need to really make an effort to ask each of our agencies that are now working, what can we do to support you to increase your capacity? Because I know, at least with Square One Villages, we could increase our capacity. We just don't have the resources to do it. If we could figure out some way to free up some resources to help existing agencies increase their capacity, I think that would be the short-term solution.
That's a great point. Steve's got a good presentation, of course, later in the meeting that we can maybe address that a little bit more in depth.
Right.
But, the tech report that the JEO, Joint Elected Officials, received last week included out-of-the-gate action, as well as fortifying existing programs. And then there are the longer-term programs too, which are all still in the formulative stages as far as how it goes into a strategic plan.
And that was important for those of us on the committee to make sure that there were some things that would happen right away, as quickly as possible. Not window dressing, things that actually make a difference, and also identify some things that aren't reinventing the wheel as well. So that was key. So we'll let Steve talk about some of this later in a
And
minute.
4 of the 6 members of that committee are at this table.
That's right. That's right. So, any other questions for Alex or Steve? Chris, you have anything more? No? Okay. All right, great. Okay, thank you, Alex. We're gonna look forward to see those numbers, and I know I participated in the point in time count again. I look forward to it every year. I hope we end it at some point, which would be nice, not have to do that. But it really, for me, as somebody who's not a professional, it takes the statistics and makes this all personal. And I think that it's an important thing to participate in. So with that, I'm gonna move on to Steve, who's gonna pass out the presentation that was made to the JEO. Just look at that.
I'm passing around a handout. I'm going to use some of the slides that were part of our presentation to the joint elected officials, the Eugene City Council and the Lane County Board of Commissioners. So I'll briefly go through the process. For about 8 weeks, Peter Chavant and myself, Peter from the city of Eugene, myself, worked with staff, various folks in the community, community-based organizations, and worked with a steering committee, and the steering committee is mentioned on this first slide, that to make recommendations on the implementation of what came out of the TAC report. And that's what you see as transforming our homeless support system. And it's important to look at this as a next step, and that in 8 weeks' time, we didn't answer all the questions that needed to be answered, and there's still more work to do. But we did put together a lot of specific strategies and tasks that need to be accomplished, and a work plan. Again, that isn't part of this presentation, but it just gives you an idea that there's a lot of depth behind what I'm going to present. So do you want to move on? Go ahead and move on to the next slide after that. The recommendations that we presented in the TAC report, as you recall, the TAC report had 10 areas of making recommendations. And in trying to figure out how to best implement this, Peter and I came up with 3 different categories of work that need to be accomplished. One is building out the perimeter. The perimeter being, when you look at the overall system, we need to expand the amount of outreach we're doing, and that not only includes outreach, but it also includes having socio-medical teams, having people who have the ability to provide health care to folks who are unhoused out in the community. Rapid exit strategies from homelessness, things like were mentioned in the TAC report, like diversion, and expanding our rapid rehousing resources, development of supportive housing, partnerships with landlords. So that really gets us to both on one hand, we're building the capacity for additional housing and shelter, and we also know that we have people who we're wanting to see in safer spots, and so we want to increase the safety and the health of people who aren't sheltered or housed during the period that we're working on implementing this. So that's the balance that we're trying to strike. The core of the TAC recommendation was all around better coordination of the existing resources and agencies that we have working in the community. And so there are recommendations around, we already have a coordinated entry system, but making that system work better between the various organizations that are working on it. Having best practice training available, particularly for our nonprofit agencies. We see that in this kind of work, there's a tendency that we see turnover during time, and so there's a need to have regular training available for all the people who are working in the field. We worked on some move-on strategies, specifically looking at how to move people who, the best way to state this is people who end up, getting housed and sort of recover from their situation, feel more stable, and in order to open up opportunities for other folks. So we need to have a flow, both through our shelter system and our supportive housing system, and then on the other end, be able to support people in permanent affordable housing. And then tenancy supports, and tenancy supports are really important. They're even more important for people who have high acuity needs, people who have physical disabilities, who have mental health or substance abuse issues. But this is everything from having, for some people need housekeeping support in order to retain their rental, because they're just not able to physically, take care of their unit without some outside help. And then other folks need assistance when they are housed with problem solving and sort of looking at what their options are. And then the last piece, which is sort of central to all of this, is that we need to have a way to rapidly respond. And I think that that's part of what people were talking about earlier. They're in working on this over the last 8 weeks with the steering committee. There's sort of a tension between doing things very quickly and trying to be responsive to what we're seeing, and then building a good foundation for the future. And so part of what you'll see in some of the actions and some of the way this is organized reflects sort of the tension between those two things. go ahead and go through these. So this is the proposal that we presented of how to get there in 3 years. And this is a 3-year plus sort of implementation plan. So the first piece is expanding navigation center types of services at our existing Dusk to Dawn site. So continuing to house over 200 folks at the Dusk to Dawn site, but bringing in a modular unit and beginning to provide healthcare, mental health services, as well as case management and other types of navigation assistance, helping people get housing, those sorts of things. So the idea is that that we bring in more services to the site where we're housing people. While we're doing that, we're looking at the design and the siting of the shelter navigation center. And again, this was something that in talking about it, you know, you either do a quick strategy or you do a strategy that involves the community. You look at all sorts of sites and you involve the community. And so part of the tension here is the more community involvement, the more public process on siting, the longer it takes to get something in place. And so that's why you see that the shelter isn't being built until the second year of the plan. And, you know, the concern is that if we were to say this is the site where we want to do it and just do it, that there would be a lot of pushback from that, and we need to have a good process to keep the broader community on board. For permanent supportive housing development, what you see is again something that is achievable over a 5-year period. The TAC report called for doing this in 3 years. A key to a lot of this is that while we have a lot of information on what we could do to develop additional permanent supportive housing, people want to have during this, you know, what I would say during the first 3 to 6 months of this next fiscal year, which begins in July, which is our year 1, people want to be able to look at, well, what's the mix of types of housing we want to do? You know, everything from something like the MLK, which is, you know, a project for a particular group of people that we're trying to help. Look at, you know, being able to do more tiny homes, looking at issues around urban versus rural, and sort of work on that some more. And so it may be, you know, that, you know, we've laid this out over 5 years, which is practical and probably realistic. But it may be that along the way, in year 2, that we have enough information, we've figured out what we need to do around financing, that we're able to revise this and get some more housing up. But again, this is a reflection of where we are now. There are lots of decisions to be made around financing, because we know with what's available in the tax credit programs from the Fed and what's available from the state, that this is sort of the pace that we'd need to go. If we had more local sources or local bonding, perhaps, you know, we'd be able to do something more quickly. The part that says people there, that has to do with the recommendations in the report. And I'll get into that a little bit more when I talk about year 1, but If you go back to the TAC report, there are recommendations to increase outreach, increase some of the staff that works with coordinated entry, increase diversion services, and so what we did there was we reflected that we want to bring on board, additional support, and what I imagine is that with the exception of some positions in year one that are proposed to be with the county, that most of the positions that we're talking about adding are going to be with private nonprofits. We also want to look at things like peer support positions. We currently have peer support positions in our behavioral health system, and where people with lived experience are certified as peer support specialists to work with people, and that's often very helpful, particularly with helping people navigate in the system. There's something on the board called Strategic Initiatives Manager. This is still a work in progress, but when you think about what we need to achieve in 3 to 5 years, there's a lot of work, and more work than all the organizations can do. And so we need to have somebody in a leadership position that can work with the city manager and the county administrator and help get resources from other groups, get community involvement and collaboration in making stuff happen. So finally, the impact of this, and I'm having trouble reading from the slide on the board. I have it right here. So you'll read along the bottom of this, the impact, but it says in year one, collective impact process, 50 units of PSH, all the services that we're talking about. And I'm going to go into year one a little bit further. And so if you read along the bottom, it sort of says what the bottom line is for all of these things. So let's go to the slide that says immediate actions will make a difference in year one. So I'll just go over all of these things again that we're looking at implementing beginning July 1. The year-round navigation center at the Dusk to Dawn site, providing expanded supportive navigation services. We'll be bringing proposals. Currently the Dusk to Dawn or Dawn to Dawn program has just been during the winter season, and so we're bringing forward proposals to the city and county to make that year-round, and along with it being year-round, having the additional navigation center services that I mentioned earlier, the design and siting work towards the 75-bed low-barrier emergency shelter navigation center, developing additional mobile street outreach teams to deliver services to people where they are. And the other part that isn't mentioned in this point is that part of what we're going to be doing is we're going to be bringing together all the organizations, Whitebird, Looking Glass, Shelter Care, Laurel Hill Center, anybody who's providing outreach services, and begin to work on better coordinating those outreach services, because currently there's no sort of central dispatch or anything for those, and those groups tend to, sometimes they might go into a geographical area where somebody else has already done work. So we need to look at how we better coordinate those efforts. The 51 units of permanent supportive housing, the Commons on MLK, we're now looking at beginning construction in the fall. We were looking at Homes for Good, who is actually building the project, was looking at closing in June. That got pushed forward because the environmental review requires that we look to see if there are Indian artifacts on the site, which that process takes a while, so that pushed the date for for beginning the construction until the fall of 2019. I've mentioned in my comments before strengthening the system coordination for diversion, coordinated entry, navigation, and the move-on strategies. And I need to say a little bit more about the move-on strategies, because actually we're piloting with Homes for Good, and Alex knows more about this than I do, but we're piloting a program with Homes for Good, where basically we're able to get more Section 8 certificates for folks, so that people who are currently in our continuum of care permanent supportive housing programs, if they're ready to move on into other housing, there'll be a Section 8 certificate for them to provide rental subsidy and housing in the community. So we have something in the works to on that. The flexible funding to respond to immediate needs, with working with people on homeless diversion, you start the conversation, maybe they have some place where they have been staying and the person who's been hosting them can no longer afford to keep them there because they're eating food, they're causing the utility bill to be more, and those sorts of things. And so the way that the flexible funding helps is it helps paying for things that typically are not paid for from public assistance programs, but little things that can make a whole lot of difference in whether or not someone sustains their housing. And then finally, the collective impact process that will be led by this strategic initiatives manager. So next steps. So the next steps are to identify strategic initiatives manager, continue to work on the details related to governance, roles, and ongoing financial commitment. And a little bit more on what that's about is that that's something we need to talk about around this table, because the sort of the governance for this and the roles is how do all of these strategies relate to the Poverty and Homelessness Board strategic plan, to our committees, and how will we work with the city manager and the county administrator moving forward on this plan. And then the other point that goes without saying is along the way to implement these things, we'll be going back to the county commissioners and the city councils, for their approval. One of the pieces of this is a memorandum of understanding between Lane County and the city of Eugene on some of the aspects of this. So with that, I'm open for questions.
Thanks, Steve. I mean, this was a good process. It was I can tell you it was a robust discussion every week that we met. There were a lot of good ideas expressed. I think you and Peter did a good job of taking an awful lot of information and distilling it into some actionable steps and strategies.
So, Steve, I've been thinking a lot about this, and just correct me if I'm wrong. I would assume that the decision for moving forward rests between the two governing bodies and their administrators. And I know that's a delicate kind of dance of how that all gets worked out, right? And I don't know what our role in that and how we can best be supportive. I mean, it certainly would make sense to me. We've had some discussion about this, that PHB becomes an intergovernmental body so that we can better be in, that group that supports the development. Because otherwise, we have no accountability, responsibility to the city. So I guess, and I'm particularly looking at you, Mayor, since you're half of that, does it make sense for us to push for that? Is that going to be the way that we can be most supportive in moving this forward?
And you can look at me since I'm the other half.
Well, you're the other half. You're not quite, I knew.
Well, it's a little imbalanced right now toward this half.
Right, right. So I do have sort of a part of a response to that, which, the first thing that I sort of want to say to the table, but also to the public around the strategic initiatives manager is there's sometimes a response like, oh my gosh, more staffing, right? There's this sort of like, really? You're going to add more staff? But I think in this case, it's actually really critical that the city and the county are trying to navigate a whole new level of collaboration and cooperation. And we need for there to be a there. We need for there to be one person whose responsibility is to bring all those pieces together, who's accountable to both bodies, because yes, it can get lost in the weeds otherwise. You've got two different jurisdictions with slightly different processes, and you could find yourself 6 months down the road not in exactly the same place. And so I think that also speaks to where the Poverty and Homelessness Board, where it could be in a discussion with that kind of role of the strategic initiatives manager, how that person is going to function. That's where I think the first conversation is does the poverty and homelessness knit into that governance structure and accountability structure? And I don't see that path exactly in a clear way, but I think that's where we're going.
And from the county perspective, we have one thing that's different to anything that we've done before is that much of the integral work as we move forward will be done by the two CEOs. And having them working so closely together ensures, or comes close to ensuring, that we will be bonded as a county, and not just a city. We're hoping more than one city, that the Springfield is going to be a part of this, and they said that they will be. But significantly, Dan, I think that as we move forward, John Reese and Steve Mokrahysky have been charged with bringing a work plan back that integrates the city and the county work strategic plans and assigning strategies and tactics that are manageable and accountable to both the city and the county. And a part of that is going to be a discussion as to whether this board, the Poverty and Homelessness Board, becomes an intergovernmental committee. Right now, it's multi-jurisdictional, but it's funded and staffed and reports to one of the bodies. And if we're going to move forward together, then it has to be, I believe, intergovernmental, not unlike the Human Services Commission.
So then we're relying on the two CEOs basically to move us forward. Is that rather than us initiating something?
Yeah, and when you say relying, sometimes you rely on things that aren't trustworthy. I think we're relying on a pretty trustworthy bond at this point in time.
No, I'm fine. I just wanted to know whether or not we should initiate or wait for them to see what they recommend.
The next thing I'll say about that is that the Poverty and Homelessness Board does have a subcommittee that is more or less charged with this, has been and kind of been waiting for its charge to evolve, and that is the Poverty and Supportive Housing Development Subcommittee. Formerly, did Operation 365, but we've the mayor and I are together on that. Chris is on that. Erin, you're usually at that meeting. Amanda, you weren't at the last meeting, but you occasionally. Stephanie's always at that meeting. So it's a really nice representation of the Poverty and Homelessness Board that's on there. It also includes Sean Van Gordon's on there, and then Cheryl's on there. Cheryl Belthrop from the Mission is on there. So it's a good representative committee. And what we'll begin to look at on Monday, on our agenda on Monday, is how do we integrate the recommendations from the JEO that Steve just went through? How do we integrate that into a strategic plan and strategic direction for that committee to actually make tactical, to recommend policy and tactics. And so that discussion will begin on Monday. So
yeah, and actually just to How that in, when the steering committee, the tax steering implementation committee first met, that first meeting, we talked about how we were going to align all of these different strategic plans. So I think that was actually our starting place.
That was our starting point,
Yeah.
that's right.
And it's not as ominous as it
Right.
seems, because the strategic plans really are woven together. And in the county, we have a general strategic plan for the county, which includes the Poverty and Homelessness Board strategic plan. And for instance, the Community Health Improvement Plan is all inside of the general strategic plan for the county. So it's not, we're not developing something new. And if you look at another sheet that was handed out, what's key to it is a section that's called Links to Existing Efforts, where we recognize things that are already happening, but as you mentioned, aren't quite robust enough or need to be fortified. And how do we do that to help us get out of the gate faster and demonstrate to us as well as to the public that we're doing something, that something is going to happen, something tangible, measurable, and something that will produce long sustainable results for the next generation to continue to work on. You know, right now, Dan, the first time I met you was in 1995. And things we talk about a disjoint core right now. How disjoint was it back then? Some things have congealed, and other things, initiatives that you've been involved with have really moved that forward. But what's missing, if you look at the graphic that we saw on Monday, is a jigsaw puzzle with all the pieces not quite touching. And so what's missing is getting all those jigsaw pieces together. It's a graphic that kind of resonated. So.
Well, Chris has been patiently waiting. Go ahead, buddy.
Thanks.
Just a quick response. I support Commissioner Farr's talk about having the Shelter and Supportive Housing Committee look at it. That said, I have a couple concerns just by the entire PHB being an IGO or in regards to the TAC when we still are missing a rural elected spot. Not saying that Commissioner Farr is not doing a great job, but we also have places like Springfield who have places on the strategic plan, but I haven't found a carve out in the TAC findings. And so with that in mind, I really want to make sure that we don't chase them away, because we all agreed at this table and at the bigger table to support winter strategies. But after our Springfield component took it back to the city, they didn't recognize how it fit into the bigger picture. And so we really need to be, if we do some kind of intergovernmental thing, that we have it to where it can be sectioned off, in my opinion, because we lost out on an opportunity to help our community because I feel like the communication or where one starts and where one ends, it was a little murky. So I yield to the board.
That's great. Dan?
Now, one other point, Steve. The TAC report mentions specifically a dormitory-style shelter for the 75-bed. And speaking for myself, I know I was surprised when they said 75 beds. That didn't seem adequate, but they convinced me. They convinced me that it was appropriate size. In light of the pit numbers, I'm now questioning that again. I just don't think it's going to be adequate. And I think there's a better model, frankly. I think we can build twice as much using the tiny home strategy. And I would just put out there, Community First in Austin, Texas is the gold standard, in my mind, in the nation for a shelter program that's just phenomenal. They now have over 200 tiny homes, I believe. It's what I call the bathhouse model, little tiny homes. They do have electricity, but no bathroom. So they're structured around a bathhouse in the middle and a little three-sided kitchen, which works in Austin, probably wouldn't work here. But it's incredibly well done. And certainly the best I've ever seen. And I think you could build twice as much for half the money that it would in doing a dormitory style.
So how much land does?
Well, that particular one has, I don't remember now, 10, 15 acres. I mean, it's quite large, but it's spread out, and it wouldn't need to be as spread out as they are. I mean, it's Austin. They have no urban growth boundary, right? So
Well, that's what I'm saying. In Texas, it's a different thing. They don't have urban growth boundaries. So what you see in Houston and other places is they're
I recognize
large
that.
Fields and turning them into housing that we couldn't do here.
But it's still just the question of whether or not dormitory style is the best model. I'm just putting that out there to take a serious look at.
And I agree with you on sort of a hybrid between what you're doing at EVE and some other.
Yeah, it's kind of, yeah.
And Opportunity Village almost.
Halfway in between.
Yeah.
The other thing I would just mention, because I remember when Jack Tripp told this to me, when community-supported shelters put their Conestogas there on mission property and moved 20 vets out of the mission basically into their Conestogas, Jack said to me, you know, I can see their health improve just in their faces. You know, there's something about having your own space, right?
Yeah.
Even though it was unheated, that was an improvement over being in the dormitory. And particularly for anyone with PTSD issues.
Yeah.
Huge.
One of the things we did investigate, and we do have an architect that we've been working with, is that we looked at both the modular options and then I'm looking at Reagan, but it's called a span structure, the sprung structure. So there are some other, you know, other options. And one that we looked at in particular was sort of this, it's used for construction and oil fields, but it's modular and it's sort of like SRO style housing. So they're quints and they're bedrooms and then one kitchen unit and one and kitchen bathroom type of unit.
Kind of the bathhouse.
And we sort of looked at that, and you could, you know, we were looking at a site where we could get 60 units on site that way as well as an alternative. Because another piece of this is if you do have a low barrier shelter, is to have you know, what's called bridge housing, where people can live for a longer period of time with, and again, it's part of moving people through.
Right.
Just one step more stable.
Right.
What I was going to mention, and something that Steve and I have talked about a little bit, is there is a potential going through the legislature right now of actually doing some development outside of urban growth boundaries, a model that's been used in Deschutes County already. So, you know, we may have some other tools on the horizon, nothing guaranteed yet. But, and the other thing, while Roxana is here, there are little triggers. You mentioned the trigger of getting your own space, how it changed, people's faces changed. Well, a trigger that I noticed is when we went from dusk to dawn to dawn to dawn, the people who were using the program out there seemed to be a lot more stable, certainly to the neighbors that I had talked with. And so, Roxanne, I see less people moving around in the community out there. So that seems to be just being in one place for 24 hours instead of having to get up and move and come back and get up and move. So identifying little triggers like that really can go a long way without a great deal of financial input, financial resource.
Well, I know this won't be the last conversation we have about how the TAC report is implemented and what some of the other things that will go into it. Any other questions for Steve? If not, what I'm going to do is Chris McAllister has a quick thing he'd like to make an announcement on, and then we'll get to our guest. Go ahead. Yep.
I just wanted to speak out as the consumer who also had the duty to serve on the TAC implementation committee. As such, there was mention of tension, and part of it's the do right now versus the do long term. And so the TAC implementation is a long-term health regimen. We are ramping up to the therapeutic doses, but we have some immediate triage needs. We need an ICU on the streets. Surgical fixes from our providers and governmental contractors. If a population is no longer being served by our focus, we as the PHB, I believe, should be advising for remedial options. Providers, big or small, look to government for ease, while government seeks outcomes and results. Communities, unhoused and housed, have needs that have local remedies. Service providers, we need you to be ready to help bridge for those who you can't serve. And staff and electeds, we sincerely need you to show clear paths that act. June 2019 to June 2020, may it be the year of promising bridges that lead to hard specifics for the totality of our unsheltered. We have a winter in the middle. Let's set the bar high leading up to this and share our successes during the winter recess. I know many of you here supported the winter strategies proposals. I recognize many faces of service. May we put so much that we change our forecast, serve different needs, and make some real change. Toilets and showers are emergency needs, as are legal safe places to please. Please help us. We can't move forward with the TAC if we don't have something now, and we need something now. So please make your asks, tell the government what you need, tell the people what you need, and how we can help our bigger community start to heal together. Trauma-informed comes from making safe answers. I yield.
Thanks, Chris.
Thank you.
Any questions for Chris? All right, thanks, Chris. I appreciate that.
Sorry.
Okay. All right, what I'd like to do now is welcome Dr. Michelle Mayer, who's a partnership specialist with the U.S. Census Bureau. She's going to be our program today.
Good afternoon from the doorway into the doorway out, and everyone else. Welcome. My position as a partnership specialist is to serve Lane County, also Douglas, Jackson, and Josephine for their needs to do census outreach and to publicize the census. Before we get to the really, just so you know, this is a 45-minute presentation in about 7 minutes. Doing my best. But, so there will be things that are skipped, and if you have questions, please do so. But before I get started, I want you to know that Jeff McGowan, the Salem Area Census Office Manager, is available by phone. We're still learning about how the homeless count happens in April, and so is he. So this is going to be his first meeting, but now you'll have his number and his contact information, because that's really going to, the purpose for the outreach to this group. But first, I'm going to really just describe the protocol of the census. And also, I want you to notice that I've handed this out. It has my card on top. It has a partnership checklist on top, and that's for you. And then I've handed out another checklist for me. So if you want me if you have some time to look it over now or later, I'd like you to return one copy for me, so I know what materials what you're planning on doing, and some ways I can support you in that. I'm also, there will be Lane Council of Governments is making a Lane County-wide complete count committee, and there is a Eugene count committee also, complete count committee forming. It's not formed yet. I'm going to request that there's a representative of this board on both of those. And there's also complete count committees forming in other cities in Lane County. I don't know which ones yet, but I'm asking you to consider having someone on this board there so that they have more information for outreach in their area and those kinds of things. So, do you have the forward? Okay, very simple. The prior census's goal is to count everyone once in where they live most of the time on April 1st. So our PR push, the planning that's happening now is really for February and March. Okay, the reason we do this is because, first of all, because it's constitutionally required, also because your budget depends on it. There are extraordinary amount of funding examples, for example, transportation and transportation planning, Medicaid, student loans and Pell Grants, crime victim assistance, Section 8 housing, school lunch, Head Start, and Children's Health Program, including the city and the county's budgets. Those are in aggregate form. It's not based on person, right? But the others are actually a certain dollar amount per person, the other budgets. This is one of the first handouts in your packet. This is from George Washington University. They did the research to demonstrate that there's about $13.5 billion that was based on census numbers that came from the federal government to Oregon this year. While that number changes, we're stuck with the decennial census population count most of the time. So that's, I'm hoping that that's adding some motivation and engagement, because we have around an 18 to 23% undercount, meaning that many addresses do not return the census in Lane County. And in the census tract just west of the University of Oregon, it's 37%. That's an extraordinarily high non-response rate. So I want to just identify that to you because your funding's based on the students, in essence, not returning their census. The good news is we have a group quarters census also that does the dorms, so that's a lot more thorough, right? Okay, so census data, other things that, census data is also used to determine legislative districts, school districts, voting precincts, and as a basis for state, local, and tribal government planning and other, of course, research, business, and nonprofit decision-making. It just turns out that we stand to receive another seat in the House. So we have a little extra motivation this coming 2020 census. A lot of people don't fill out the census because they're concerned about its confidentiality, and they might even know that the census shared private information in 1945. So the census wanted to correct that, and in 1945, it became protected by Title 13. Under the Patriot Act, the military in 2012 tried to receive individual census data, and the census said no way. And they were brought to court, the Supreme Court, and Title 13 beat out the Patriot Act. So we're really proud of that, you know. The census does not share information from the decennial census until 72 years later when it's used for ancestry reasons. And all census employees take a lifetime oath, and there's pretty severe penalties for each data bit, 5 years and $250,000. So this is your cheat sheet to confidentiality and the census. It's in your packet. So you can do, if you want to, a little extra reading because, you know, I don't expect you to remember everything I'm saying, you know? Okay, thanks. Next slide. So what do we ask? Name, address, phone number, gender, date of birth, race, ethnicity, and relationship of each person at that address. And the citizenship question is with the Supremes right now, so when the Supreme Court decides, we'll get back to you. It was not our interest to have that added. Okay, why we ask? This takes a while to describe, so I'm gonna leave this. If there's one thing you do read, I suggest you read this. Okay, what's new in 2020? This time, we're using the internet. Yay! So every address will receive a census form. It'll have a special number to that address. And then you can go online, fill out your census form, and hopefully that will mean that we won't have to hire a lot of people for non-response follow-up. It's also available in the paper form. You can also fill out the form that's sent to the address. And there's a toll-free number. That is, there's people who speak 12 languages. It's pretty much everything you expect, except there's no native languages, and not Hindi. Just saying, I noticed it was missing. I noticed they were missing. Technology. We have some new handheld devices that help the census. The biggest operation for the census is actually hiring right now, and there's lots of jobs in Lane County starting at $17.50 an hour. No bennies. But most people who, as long as they're doing their job competently, are renewed for a year to a year and a half. The device for address canvassing is the next largest operation, right? And that's checking addresses. Literally, someone walks to your address, double checks it in the computer, and makes sure there's no new construction. Every once in a while, there's a new construction development that's missed, causes an undercount, and then the city has to petition to the Census Bureau. So that can be a really arduous process. When will we start the census for everyday people, not for census workers? People should receive an invitation to respond online on March 12th and a few letters. The last reminder letter is at April 20th when it'll be followed up in person. And that's when a census worker goes to that address and tries to find some information so that there's a little bit of estimate that happens with that in that non-response there, but often there's no information that happens. The numbers that you'll see on the, I'll talk about Rome in a second, the area mapper where I got that 37% undercount for the tract next to the university, or west of the University of Oregon. That's after a census worker has gone to all of those addresses. Okay, that's after. So when outreach, in terms of the undercount, usually there's certain demographic categories that falls within. But like all generalized data, there's everyday people who don't fall into these categories, who don't fill out the census. But because of we generalize, right, the highest demographic categories are like this. First of all, children younger 5 for some reason tend to be missing from the census entirely. We can't figure out why. It's possible that they represent younger parents that haven't filled it out, but we don't know that. Seniors, particularly those that they're not in facilities and it's just reaches to too much. Young people that were 9 when the census happened last time, and so they just don't know about it. And in the age of identity theft, it just gets recycled. Renters and people who move often, people who live in poverty, people without internet access, migrant workers, simply because they don't receive a census form, people who are foreign-born and immigrants, or also known as immigrants, and then people who are homeless. We know that the homeless is a pretty significant undercount, and between you and I and everyone else, that the one night count is severely inadequate. It happens to be the way that it's happened all around the country. We're not allowed to change that format, but there's probably things that you can do, and why I'm here, to organize helping that be more thorough. Because you already know how you do the one night homeless count in the first place. So, okay, next slide, please. Okay, so what you can do, I'm asking you to, in essence, become a partner with the Census Bureau, to connect me to your networks, and to reach out to your own network And some things I can provide you, for example, census logo, some drop-in articles, accurate information like that in your packet. Even publicizing that there's jobs as a way to get the census on people's minds so that they start to consider some of the reasons they would fill it out. And the more that we recognize that our budgets are based upon it, and often for people, a lot of the services that they use are based upon it, they're more willing to fill it out. The census does not it can check the information, but the census doesn't have personnel to check the information on the census forms. A lot of that is just used so that we make sure that if we get 2 forms from the same address, we can check the name and make sure it's not double counted. Because we don't want the error on either way. The census doesn't want the error either way. Okay, so another thing you can do is contact me. Y'all have my card now on your form. And could you do I have one more slide on there? No. The other thing is I want to encourage you. I've made a new slide, and I just made it the other day, so it's not on here. And it's about some of the specifics of the responsibilities of a complete count committee. I believe a complete count committee can meet as little as 2 times, but 3 is better. They usually need time to hear this presentation. But this does not describe what a complete count committee does. It just offers accurate information about the census procedures, when it happens, timelines. What I would suggest is that you invite all the players to the table that do outreach in that area, and in this case, for people with unstable housing. In addition, you look at what could be their motivations for filling it out. Are there events where you can work together with the organizations at the table to create some event or some PR or some way to get the message to that population that it's needed? And a lot of the funding that's going to people who have inadequate housing, like, for example, SNAP benefits and stuff, it's directly based on the census. I do not know if that's based on last census's homeless count, because the census has its homeless count separate from the HUD housing count. What else? And then also just for each organization to figure out how to reach out to the populations it serves that are hard to count, and figure out how it can do that. We do have a group housing. It is possible to find some way to kind of combine with that if people are temporarily in a group housing situation, but that's not fully the responsibility of this committee, right? Okay, that's the major stuff here.
Great, thank you. Chris, you've got a question.
Yes, thank you for your presentation. Is there, when you talk about these count committees, are they only jurisdictional, or do you have focus groups for, say, the homeless count, the underserved at risk? Do you have would you have a countywide senior homeless count team? I mean,
That is under the decision-making of if any person or committee, if anybody, any person wants to make a committee, and you invite me, I'll be there.
Sure.
It doesn't have to be officially sanctioned by Lane County, this board, or the or Council of Governments, for example. However, I want you to know that the Lane Council of Governments is making a county-wide committee, and that's why I was inviting someone from this board there, so that there was at least a voice and a liaison to keep communication with this board, because I won't be coming that often to this meeting. Also, there's a Eugene citywide, but that date, neither date has been set, and the membership has also not been set. So this is a wonderful time to ask that question and to figure out what kind of representation you want on it. And if this group wants to be a complete count committee, and you can add or subtract anyone you want, I'll come here again and I'll facilitate it if that's what you want.
We'll take that, we'll discuss it.
Yeah.
Thanks. Go ahead, Dan.
Alex, would you back up the slide with all of the undercount listing? Yeah, there you go. So if you look at that, the last 1, 2, 3, 4, 5, 6, the
all of them.
last 6, people who live in poverty and down below,
It's everyone.
all, I mean, that's us, right?
Right.
And even the
seniors.
top 3 to some extent.
Most seniors.
Particularly those last 6.
Yeah.
And so it certainly makes sense that we would put some effort into this. And I don't know if it requires quite that all-out effort of the point-in-time count, because that has to be done in such a short time. This, we have a little more time. But
Also impacts our funding.
yeah,
The,
and it impacts our funding. So it just
Yeah.
makes sense. I'm just saying, it just makes sense for us to put a similar effort as the point-in-time count into assisting this.
Agreed.
I want to add that when it comes to people who are without homes, that that is a point in time count. It does happen around one of the dates around April 1st. There, I can call Jeffrey McGowan right now and have him answer your questions about exactly how it happens. But we usually, my understanding is we pair up with a police officer, census workers, and go to places that homeless people are known to be, which means this group would be a consultant to the Eugene Census Office when it opens in August to figure out where those places are. And I was going to just recommend that there be a kind of event that just happens to be at 11 o'clock at night on April 1st. Or something like that, but in coordination, direct coordination with the office. I don't know if that can exactly happen, but it was just an idea that I had.
Great, excellent. Go
There's a
ahead.
bullet point missing. Senate
Veterans.
Republicans.
Ah,
Just in Oregon.
that's funny.
They came back.
They came home. They came home. All right, we have some things to consider with your requests, and we appreciate you coming in today, and we'll certainly be in contact with you.
Okay, thanks so much. For those that are representing pretty much everyone here, maybe with the exception of the city of Eugene and Lane County Commissioner, because the commissioner is already on board with LCOG, would you please consider filling out this form for your organization?
Right now?
No.
Yeah.
And then just hand me back a photo so I can get some materials to you, and if you want me to come meet with you, I'm willing to do that. Thank you again
Thank you
for this
very much.
time.
Appreciate
Have a
it.
wonderful week.
Good presentation.
Thank you.
Okay.
Very helpful. All right, so I'd like to move to our public hearing, our public comment period.
Forgot.
It's 3 minutes. So we've got 4 people that'd like to talk.
way?
Heather from Whitebird.
Here's-
My name is Heather Silicki, and I'm one of the leadership team members for Whitebird with a focus on operations. I have 3 things I wanted to talk to you about today. 1 is a concern, and 2 are opportunities. The concern I have is smoke. We're getting close to the time when we're going to be getting really smoky weather. And this will be our third year without an emergency plan for our unhoused members. We have multiple days where it's in the black, like it was last year and the year before. These people are going to be out there, vulnerable populations, in horrible conditions. I would like to ask this board to please work with emergency management to come up with a plan that we can implement this year. The Armory could be a great cleaner air shelter space. Please consider it. So that's my first item, the concern. Now my opportunities. So I wanted to let you know about Whitebird. We have currently, thanks to a generous donation from Hope on Wheels, we've acquired a medical trailer. It's a 19-and-a-half-foot trailer that's been specifically converted into a facility that we can use for an exam room. It's going to be great. We'd like to place it at places that don't have medical services, and we hired a new doctor. We have hired a new prescribing nurse practitioner with a focus on telemedicine. We're moving our dental clinic out of the basement into its own facility, increasing capacity by 75%, and we're looking at a way to create urgent care in the space that's left behind. We're also moving our crisis facility to create a more trauma-informed space. It's going to be located adjacent to Cahoots. So that's a great opportunity for all of you if you need these types of services. And then the last opportunity is our next door neighbor came up to me and talked to me about the house next door to 341 East 12th Avenue. It's at 361 East 12th Avenue. It's a 5-bedroom SRO on an acre lot. It's zoned R4 high density residential. I've already flagged Stephanie, so she knows about it. But we would love to, since you know how hard it is to site facilities, well, we'd love some neighbors that we know can be served by the Poverty and Homelessness Board. We have support groups 6 days a week for people with substance abuse issues right next door. We have homeless services there. We have counseling. We would love to welcome neighbors with persistent mental health issues. So please consider that. This is a limited opportunity. It has not been placed on the market yet. And it's just a good opportunity. I don't have a price for you. It's listed on Zillow for $500,000, but R4. So thank you.
Thank you, Heather. That's good to know. That's good information. Diana Belofsky?
I'm Diana Bielowski. Thank you for this opportunity. So I've been to enough meetings now to see that how we measure success is 50 units of affordable housing a year. But what nobody is looking at is all the units that are getting disappeared each year. We have probably between 500 and 1,000 just this year that have disappeared to short-term rentals. And think about the amount that it costs to make each unit, minimum of $250,000. We're never going to get those units back. And the issue also is that we don't even know if that's the appropriate count because everything is shrouded in privacy now. You know, LLCs and different policies that won't let us even see how many units are being lost. But there's a simple fix. We can, well, not me, but you can ask for a resolution that in everybody's property tax, we include a questionnaire asking for the use of every property that people are paying taxes on. That will not deal with horrible privacy issues. It won't be a Fourth Amendment issue. It's just straight up, what's the use of your property? And then we'll know how many units of short-term rentals we have. So just wanted to tell you that. And just real quickly on the issue of where to site emergency housing that the Reverend was talking about, I have been working on another project called the Leviticus Project for a number of years, which would go to different religious spiritual bodies and ask congregants, instead of tithing with money, tithe with a part of your backyard or your side yard to put a tiny house. And I could right away, if I had people to work with on this, could find 20 spots, including my backyard, where we could put a place for a houseless to live. So thank you very much.
Thank you. Those are good ideas, good thoughts. Thanks. All right, Lee.
Hi, so my name is Lee DeVoe, and I am wanting to talk primarily about low barrier shelter and the recommendations of the TAC report, specifically around the criteria necessary for success. And so the first is that the shelter be centrally located and easily accessible. The second is that it's open 24/7, and that's open for people to come in and be taken into intake. The third is that it include the options for couples to sleep in beds next to each other, allow pets in the space with their owner, and to provide safe storage for possessions. And these are all issues that have come up in other shelter situations. And when these things have not been provided, the shelter, people have refused to go because they're not going to go without their pets. They're not going to go if they can't have their possessions, and they're not going to go if couples aren't able to stay together. I mean, this is just basic. So I strongly urge you to meet all these criteria. And I know that the central location may be the most difficult. There's a lot of pushback around that, but I think you need to commit yourself to doing that. Since the current timeline for a shelter is, I had 2 years, but it's 3 years actually. I want to stress how important it is that a transitional program also meet this criteria. So it has to start now. And there's a lot of confusion in the community right now about the dawn to dawn and dusk to dawn programs and what their status is. I mean, people don't know if they're open. They don't know if they can bring their pets. I hear people were staying in the dawn to dawn and were told it was closed and they left, and then they were told they could come back, but they couldn't bring their pet. And so, there's really a lot of chaos right now. And I understand there's a lot of transition going on, but we need to do better. If you actually want to serve people, you need to do better. Sorry, I'm trying to be fast about this. Okay, and so the other thing that is glaringly missing is representation of unhoused people in this process, both in the design and in implementation. It is just shocking. And, I have great respect for Chris and all the work that he's done, but there needs to be, really a broad spectrum of voices among housed people. If this is going to have, any success, to be meaningful in any way. I mean, you're talking about chronically homeless people who have been out there for a long time. They know how to survive. If you actually want to bring them in and offer something different, they need to be part of the conversation. They need to lead the conversation.
We're at about 3 minutes, so.
Okay, one last thing.
One quick one, very quick.
Okay, very quick. I am advocating for the establishment of an ombuds position to represent unhoused people, both in complaint process as well as to monitor programs that are serving them. I hear a lot of complaints from people about, programs cannot monitor themselves. They're just not capable of that. There needs to be a third party who can go in and mediate. Thank you.
Thank you very much. Good ideas. All right, John Thilking.
Hello, I'm John Thilking. I'm having a number of hats today where I'm one of the co-chairs of the Lane County chapter of the Pacific Green Party that has in the past endorsed my couchhosting.org project. I'm also curator of the latest project, which is the busstation.org. And I'll pass the flyers around. You can have one if you want. It talks about in detail about what I'm doing with the busstation.org, which is to provide houseless people and housed people alike with safe, secure storage for their belongings at a rate of $15 a month for a 4.5 cubic foot locker, which is maybe a little bit more than what you pay at a regular storage locker facility, but you don't require to have an address in order to sign up. And also, it could be potentially located in the downtown area because it's convenient for retail owners of retail stores to set these up. The latest numbers are actually pretty good comparing return on per square foot retail versus these lockers versus vending machines. It blows vending machines out of the water, and depending on whether the owner of the store owns the lockers, it could also blow retail sales out of the water too, and while providing a very reasonable rate for a locker. And also, just as a side note about designing programs for homeless people, I do have a couple of homeless people that are actually informally on my, what I would call the design committee for couchhosting.org and the busstation.org. So I do routinely accept input from them and from all parties that I consult with, like the city or the Legal Shield or whatever. I accept the input from all those before I decide what I'm going to design for my programs. And then finally, a little brief ad for the Catholic Community Services is having today only a fundraiser at the Carl's Jr. at Gateway. 100% of the proceeds from the sales from Carl's Jr. at Gateway are donated to Catholic Community Services today only. And if you're queasy about Carl's Jr. not being vegan, they now have the Beyond Famous Star burger, which is basically made out of pea protein, maybe made out of soy. So you can have. I went there just a couple days ago and made a triple burger out of their their pea protein burger. So pretty good.
Thanks very much. To thank everybody who took time to come here today and to speak. There were some good things said to us. Did you not sign in?
I didn't see.
Okay, all right. Please come to the front. Sure, tell us your name and.
Yeah, my name is Tom Brandt. I haven't been to any of your meetings, but I was active in, I think it was '89, in the Affordable Housing and Homeless Task Force. And I made my own presentation to the commissioners at the time. Of course, I think it was a little futuristic at the time, maybe not now. Just a couple things I got from this meeting. The low barrier shelters, I think that was covered, you know, showers and toilets and trash facilities, you know, that's, and facilities for the different types of people, you know, families, those that need like care, alcoholism and all that. And I don't think they should all be grouped into one thing. It needs to be separate. Existing agencies can get more space. There's some out of the box ways that can happen. The deal out on MLK, 51 unit construction. I'd like to look at the plans. I mean, I was a carpenter. I know building. Two of us created the Office of Appropriate Technology. My partner there was a grant writer. Didn't know anything about appropriate technology, so it was my information. We got I think it was $130-some thousand for 12 positions.
Right.
And we dealt with all of it. Solar was a good one, which leads to, I heard unheated here. These little tiny homes, the Conestoga shelters, they can be heated if you know how, if you put some thought into it. You know, I've been to the riverfront meetings, the first City Hall design meetings, the courthouse. Seems like a lack of thought into like passive solar. It's low cost and it can heat and cool. In fact, a short story on that. Harris Hall.
You have about 30 seconds.
Harris Hall was hot one summer. Archie Weinstein was whining and crying. And so I went in there early one meeting, opened a window, opened the upstairs door, had the maintenance guy put the sprinklers on outside in the grassy area, and the commissioners walked in and looked around. They thought they'd already bought the air conditioning unit. And I went, it's natural heating and cooling. And they spent,
kept whining anyway.
yeah, and they spent $10,000 on air conditioning anyway. And I think that's flexible funding. Timber companies, the county gives them, up by my place, old growth timber, gives it to them. And I figured at least $15,000 just in the short space. And, you know, funding. Maybe the timber companies could donate
Thank you.
some lumber.
Yeah, thank you. I appreciate your time.
Sure.
You bet. All right, with that, I'm going to conclude the meeting unless there's anything else. Or you'd like to stay for another hour or two? All right, thank you.
Thank you.
I'm working, I got finance and audit. I'll give you a call later.